morning, ladies and gentlemen. My name is Jayan, a member of Starcare family, Starcare Hospital, Starcare Health Systems. We operate into the hospital and medical centers and pharmacy sector. I would like to thank Mr. Michael and Dr. Abdullah for the wonderful presentation and the initiation of many concerns and discussions and points here. I also would like to thank the organizers of this event. The reason is that since last 5 years, every year, most of us used to go to Dubai to see the Arab Health, where we see the cross-section of what is happening in the healthcare sector, what innovations are happening, what is happening around the world, and we go from Muscat to Dubai to see that. In every trip, I used to think that when are we going to have something in Muscat rather than going to Dubai? When are we going to invite people from other countries to Muscat to present something like this? Definitely this is we cannot compare with those things, but certainly it is a great beginning. I am sure that within a couple of years' time, this effort will evolve as an equal activity which is happening in maybe in Dubai or Qatar in later. And I again appreciate the organizers for the same thing. Today, I am here to share the challenges or the problems faced by private healthcare industry. Actually, I am not going to go with a presentation which is showing many facts and figures. My intention or my effort is going to be to share actually what I experienced in Oman since last 5 years. I was a part of commissioning 3 50-bed hospitals, the real hospitals, 6 medical centers, and 6 pharmacies in the private sector in Oman over a period of 4 years. I came in Oman from Dubai in 2008 to study about the healthcare potential in this market. Do we have opportunities to explore in Oman? And later, it ended up in commissioning this many facilities and running the facilities. During that journey, I have experienced, I am sure the same thing is the story of other private healthcare operators, experienced n number of challenges, struggles in setting up hospitals and other healthcare facilities and making it operationally viable. I have keenly observed the issues and I wanted to share those challenges which we faced and how we tackled and how we can be prepared for the future with all of you and the public sector. That is what the focus of this presentation. If we see the history of humankind, revolution has happened in every areas of life. And one of the areas where maximum revolution happened was there in the healthcare. We actually started from Hippocrates, the father of medicine. Today, we are in the era of nanomedicine. We are there in the era of nuclear medicine. Today we are using robots to treat us. This is what we call revolution. This revolution happened because of only one thing, because it is the question of the life, the question of our survival. So we have to keep change, we have to be very innovative to protect our lives. That is the reason actually this kind of revolutions happened in the healthcare industry. If we look into the pattern of healthcare industry, whether it is public sector or the private sector across the world, you can see a huge growth in last 1 decade. Lot of changes happening, lot of advanced technologies coming in, and the healthcare is becoming more comprehensive and sophisticated. But when we look into the private sector, just before the recession period, actually this phenomenon started everywhere in Asia. Look into the India, look at China, all GCC countries. There were a lot of advancements happened in healthcare sector, especially in private healthcare also. During the recession and post-recession time, if we look into the business strategies, there are 2 areas where less affected. One was healthcare and the other one was education. Actually, this prompted the investors or the investing organizations to focus on these two areas because their investments are more safe. After 2000 or 3 years back, again more funds has started coming into the healthcare sector. The beneficiary is actually the private healthcare. But when we compare all these revolutions, all the changes happened in healthcare industry, when we compare in the private sector in Oman, where are we? Certainly public health sector in Oman is one of the best in the world. It is in the 8th position as per the World Health Organization. It's a very proud achievement. It is because of the leadership of this country. But when we look into the private sector, you know what is the private hospitals available in UAE, in Saudi Arabia, Qatar. But how many private healthcare organizations we can point in Oman? Why we created such a gap? This is the one of the discussion point which we are going to do it here. I wanted to segment our private sector, the Oman private sector, into 3 areas: past, present and future. Past, what I am talking is that at time just before or till 2008. When I came in 2008 in Oman to find out the potential of this country to start business, private hospitals or medical centers, there was only one hospital we can say, okay, this is a private hospital. There was only one entity. But there were many polyclinics which does the function of the hospital actually. They are not meant for hospitals, but polyclinics, multiple specialties, they do the job of the hospitals. If you go to interior, you can see single doctors practicing in a single room or a small villa or a small shop, seeing the patients. Most of the people see more than 50, 60 patients in a day in 9 hours time. This was the structure of private health sector in Oman till 2008 or 2009. When we look from 2008 to 2013, or we can say till 2015, there were few private hospitals which is structured as hospitals started. If you look again into that, actually these hospitals belongs to corporate companies, corporate healthcare management companies. They are doing business outside Oman. They are mainly based in Dubai or they are mainly based in Saudi Arabia, and they have seen a gap in private sector in Oman. They got a lot of fund. It can be equity fund or many other funds which they wanted to invest everywhere. So they find out a place called Oman. They started coming in. But they were not ready to come up immediately with a 250 or 300 bed hospital which need 20 million real or 15 million real investment. They tried to test it. They came up with a 50 bed hospitals which cater into the secondary healthcare segment. When I actually started the first hospital project in Muscat, we approached a bank for a financial loan. Bank said we cannot provide loan for the private hospital because the success story in the private hospital sector is not positive here. So we don't have confidence, we don't have trust in that. But that hospital became successful. We made break even in 8th month, operational break even. Actually that created a small change. That created some confidence in the banking sector. The financial investors, they started understanding that there is a potential. What we were doing till 2008 was basic care, clinical care, primary health care, and we depend on the public hospital for the secondary and tertiary care. If we look in now, since last 2-3 years, maybe till 2015, we will see many hospitals. They are mainly focusing into the secondary care. Definitely there are certain areas they are doing tertiary care also, maybe knee replacement, spine surgeries, but as such these hospitals can be considered as a secondary care provider. The question was that government was very aggressively supporting the public sector. People can utilize that. The Oman public sector is very strong, healthy, well equipped, but still we have seen nearly 70 to 75,000 people flying out of Oman to Thailand or India to get done the tertiary care. You cannot find actually a single investment initiative from the local investors in Oman in the private sector. Hospitals brought money from outside actually. This is not because of lack of money. There are many big business organizations in Oman. They are doing a lot of successful business, but they were hesitated to invest in the healthcare business because of lack of expertise, lack of confidence. In addition to that, the lack of support in changing the private healthcare industry in Oman. Everywhere in the world, the complete governments are trying to go away from the public health system and they are promoting private healthcare because it's a very costly affair. A big percentage of their budget is allocated to the public health system. It is unaffordable for most of the countries. I will say except maybe the oil-rich countries because they have fund right now to provide the public healthcare system. Maybe that will not be the future stage. So we have to realize that the importance of strengthening private healthcare system is very important to have a balanced healthcare services in any country. This is the time we need to change. This is the time the governments need to find out the solutions like private-public partnership or supporting private healthcare institutions, creating policies which support the private healthcare providers, create policies which will support the investors to pump in money in the country and to do the private healthcare business. We are actually looking into this presentation on this context. Till 2008, the market was really immature. Private healthcare market was totally immature. Mainly it was dependent on volume business. You go to a clinic, you pay just 2 riyal, you will get a consultation. Sometimes they will give a paracetamol tablet also. But the doctor has to see more than 50, 70, 80 patients in a day to make something. We know that when a doctor sees more than 50 or 60 patients in a day, what is the quality he can provide to the patient? Limited services. You have only GP or base level specialties. When we look at the present scenario, market is maturing, the market is growing, many new international hospitals are coming, they are ready to invest here, they are seeing an opportunity. Slowly, even the earlier clinical healthcare providers, they themselves are trying to upgrade into a better place, into a secondary care provider level. So the market is now growing. Secondary and specialized cares are available in the private sector. And when we talk about Vision 2020 or Vision 2050, already the science started. International medical city is coming in Salalah. Barka, there is going to be another medical city. Shinas is going to have another medical city. So huge tertiary care investments are happening. That is what we are going to see maybe after 2015. That is the hope that time we may not be, we don't want to fly to Thailand or India to have a surgery done. This is what exactly the planning department is aiming. These slides actually I am not giving much importance because it was shown yesterday by various presenters. There are 12 hospitals in the private sector. There are 713 polyclinics, clinics and medical centers here, and there are 442 pharmacies as per the data in the private health sector. Doctors, 1,412 doctors in the private sector, 425 dentists, 1,859 nurses, and nearly 1,000 pharmacists working in the private sector. This is the present scenario. We are spending 4.9% of the budget for our healthcare expenditure. When we look into the other GCC, UAE or Saudi Arabia or Qatar or United States, their expenditure on the healthcare from their budget is much higher than us. Still, Oman is providing the best public healthcare system. That shows the efficiency of the system. We need to appreciate that. I wanted to categorize the challenges. Mainly actually the focus is going to be on HR challenges in the private sector, but it will be incomplete if I don't touch into other financial and operational and economic challenges which private sector faces. In HR, since the healthcare sector is booming everywhere in the world, there is a huge demand of medical professionals, doctors, nurses, and other paramedicals in India, anywhere in GCC, other GCC countries, Arab countries, everywhere the healthcare industry is booming. So the demand in the market, whether it is public or private, the demand for the medical professionals are very huge. But when we look into the supply, the people passing out from the colleges, various medical colleges, training institutes, that is actually not matching. So our demand is keep going high and the supply is not keeping that pace. So there is a gap, demand versus supply gap, which is actually increasing. That is one of the biggest challenge, whether it is private health sector or it is the public health sector, which we are going to face is that demand, the gap in between, the increasing gap between demand and supply. The other challenge is skill availability. Suppose we need 1000 staff nurses or 150 doctors, we go and recruit in many countries, doctors are there, but may not be. We don't have the, or actually the availability is not what exactly we need. Suppose a tertiary care medical city is coming in. We need highly skilled medical professionals in maybe in operation theaters, ICUs, NICUs, dialysis. The skilled employees requirement is high, but the availability is very less. This is another challenge in the HR, availability and skill of the required skills. Pay structure is another HR challenge. I used to go to Philippines or many parts of India for the recruitment. In Abu Dhabi, a staff nurse, a HAD licensed staff nurse gets a payment structure of 7,000 dirhams to 10,000 or 10,000 plus dirhams in a month. In Dubai, average salary of a staff nurse will be 5,000 to 6,000 dirhams. But in Oman, in private health sector, we pay an average of 350 to 400 riyal. When we go to recruit in Philippines or in India or any other places, people has got choices because the requirement is everywhere. Recruitment agencies are filled with a lot of requirement from UAE, from Saudi Arabia, from Qatar, and many other parts, Western countries. So the employee, the skilled employee has got a choice to select whether I should go to Abu Dhabi or I should come to Muscat. What is my benefit? So actually practically what happens, the cream of the talented skilled people will end up where there is higher pay scale, and we recruit the second layer of semi-skilled medical professionals that will have a different impact in the service delivery. This is actually the another important challenge which we are facing here. Local supply and local demand. We have training institute here. Whoever is passing out from the government training institute, locals, are immediately absorbed into the government hospitals. Maybe by 2015, all our government hospitals will have 100% Omanization in staff nurses and other paramedicals. But the supply to the private segment locally is actually zero. You hardly find Omani national staff nurses in private hospitals because they get immediately absorbed in the government hospital. So there is an immediate jump happened in the requirement of paramedicals, allied health workers, but the local supply is limited. So we have to totally depend on other countries to bring and provide the service delivery. So local supply for the requirement, including the private sector, is actually a challenge. MOH regulations and licensing. I wanted to share a small experience. When we were commissioning the Starcare hospital, we wanted to have 70 to 75 nurses there. as per the Ministry of Health regulation, we need to bring all these people to Muscat. They will undergo for an examination in Ministry of Health, and those who are clearing the MOH examinations will be licensed in the private sector. So if I want to, normally the passing ratio is 70%. When 100 people write the examination, nearly 50 to 70% people clear the examination. So if we want to bring 70 people, you need to bring around 250 people from Philippines or India in Muscat to write the clear examination and get it done. Think about the cost. So I requested the MOH, send us 1 or 2 inspectors with us to Philippines or India. We can do the examination there, so that we need to carry the cost of only 2 or 3 people. Whoever is passing, we can you apply the site. They tried to help us, to be frank, but it did not work. The question is, when we are talking about the bigger hospitals tomorrow, medical cities, you require 200, 300, 400 nurses, we are going to have the same problem. So we need some kind of solutions for that. So licensing is essential. We are positive to that, but there will be more affordable solutions to tackle that challenge. Recruitment and retention. It is a common phenomenon everywhere. Recruiting the people is easy, but retaining them with you for a long time is again an issue, which we need to have very positive, aggressive HR rules. Operational challenges. Encouraging nationalization policy versus skills available locally, which we have already discussed. Tertiary care is still a major challenge. If we look into the available staff nurses in Oman, whether in private sector or public sector, people talented or experienced in providing tertiary care services are very less. When we come up with a lot of tertiary care hospitals tomorrow, the requirement of that skilled or dialysis skilled or NICU skilled, otherwise people with required high experiences or skills, that gap is going to be high. So that we need to think right now how to train the existing population to match tomorrow's requirement, especially in skill wise. Quality, awareness and compliance. When we received JCI accreditation of our hospital, we met few doctors and we said we got JCI. Most of the doctors asked me, what is this JCI? JCI is an accreditation which is internationally well known, but including certain our doctors or medical professionals, they even doesn't know what is JCI. It is not the mistake of them, but it is the mistake of our system, because the awareness of quality is very poor. So quality, awareness about the quality and its compliance is an operational challenge, which when we come up with the private segment, it is going to continue as a challenge. Another challenge, logistics. Most of the medical equipments, whether it is CT or scanning machine or beds or any ICU, ventilator, whatever it is, actually this market is depending on neighbor countries. The actual providers, suppliers are somewhere there in Dubai or Saudi Arabia. They will have a small office here. They go through the UAE and other markets, so your cost is increasing, the time is increasing. It took 4 to 5 months time for us to get hill room beds in Muscat when we commissioned one hospital. It hardly takes 1 month, because the supply chain system, medical equipment, consumable supply system, chain system is very weak in this country. When we come up with very many advancements or the bigger hospitals in Oman, parallelly the logistics has to improve, otherwise it is going to create a problem in the supply chain management. Economic challenges, project and pre-project cost is something very important in private sector. I have seen one or two hospitals which closed after opening because of the financial crisis. I have seen certain private hospitals or medical centers taking nearly 4 to 5 years time to complete a 50-bed hospital. We have a history of completing one hospital in 363 days from the designing, approval from the Ministry of Health, equipping, manning, commissioning, and running the hospital in 363 days. What is the advantage on that? When you reduce your pre-project cost or the time, your cost is saved. So you are able to become operationally, financially viable very quickly. Why it is happening in Oman? Because you won't find any professional or experienced hospital designing companies in this country. We need to depend external people. Logistics is an issue. Recently, the licensing of the doctors, we wanted to bring a urologist from India. Now the Ministry of Health, we need to put the complete papers in MOH. You will get the licensing date, the interview date for that doctor maybe after 3 months now. It may sometime take 3 to 5 months time. So you are bringing a doctor after 5 months. If he pass, then he will resign in the working place. That will take another 2 months. So ultimately you will get the person at the end of 7th or 8th month time. So what is the business viability for that? There are many chances that doctor will get a different offer from UAE or other place. They will immediately go there and join. They won't be waiting for 8 months. So these are the issues which affect the project and pre-project cost. And when we look into the construction area itself, we don't have actually quality people experienced, or the contractors or the suppliers experienced in international level hospital standards. We have lot of contractors here, they do the normal construction work, business malls, commercial complexes, but the design and the construction of the hospital industry is much complicated. You have to have the medical gas line system, you have to have nurse calling system, many other complicated systems is integrated into that, but we are not able to find out the right people in this market. Again, you have to depend on the neighboring countries. That increases the cost. If you look into the supply of consumables in this country, it is costlier than any other neighboring countries because the logistical issues. All these things put load on the cost of the operation, and the project becomes financially not viable. Or most of the people runs the private organization with a thin margin of profit. That is the reason many of the time the investors are not ready to invest in the private sector here because the profit margin is very less. If we consider salary of a doctor, a super specialist or a urologist, maximum we can actually provide 3,000 to 3,500 real in the private sector here. He will be immediately getting a job in Abu Dhabi with 5,000 to 6,000 real. So we will not be able to afford such highly skilled doctors here. But what is the consultation charge we can charge here? I believe in the private, many hospitals are there, we can actually charge maximum 25 real for a super specialist consultant level doctor. That is what we are doing. But if you go to Dubai, in any of the better hospitals, even a specialist doctor, we need to pay minimum 500 dirhams for the consultation. So where is the difference? The cost is almost the same. The revenue is lesser than the other place. So it affects the profitability of the business. That adversely affects the investment opportunities or the motivation of investing in the private sector. That is definitely a challenge. When the financial pressure increases, we always try to cut HR budget, we try to cut the rent factor or many other related areas. That again, quality will suffer. Aging population versus preparedness. As per the study, actually yesterday I have seen a presentation here, we are going to have a huge volume of aged people after some time. The skills required to cater those requirements is totally different. It is going to add more financial pressure to the public healthcare system. That is going to be an economic challenge which we should be prepared now itself seeing that challenge. Health insurance industry. Most of the private hospitals revenue pattern, if we look, 70% of the revenue is credit business, mainly from the insurance companies. Only 30% or 40% revenue comes from cash business. But their monthly fixed expense is more than the cash business. So most of the private healthcare operators, when we look into the paper, it is profitable, operationally break even or profitable, but you have a very huge cash flow issue. Here the insurance companies pays to the hospital maybe after 4 months time. So 4 months your money is blocked somewhere and you need to find another cash to run the business. And the premium, which is, or the discount structure, or the discounted rates given by the insurance sector is also very less when we compare to the neighboring countries. So there is some kind of insurance monitoring or cost evaluation is required to save the private health sector, otherwise it will have a very negative impact in the industry. Healthcare in remote areas, we tried to open many medical centers, suppose in Shinas or in Sur or remote areas where we have 25 to 40,000 people staying, and when we look into the doctors, they are not ready to go to remote areas. The reason is that they don't have proper education system for their children. The entertainment facilities are not there, so they ask either more remuneration or they will say, no, I am ready in Muscat, but I don't want to go to remote areas. So spreading or penetrating into the remote areas of Oman is really a challenge. We need to find out innovative solutions if private sector need to provide quality healthcare in the remote areas of Oman. Less number of medical institutions too, which already we have discussed, that we have very less training institute to meet up the future requirement of the medical professionals that has to be activated. Limited scope of professional development. These are the challenges summary which we have already discussed. How do we resolve the challenges? We have challenges, now we need to look into that, how we can sort it out. One thing, in the private sector, we need to look into broadening the recruitment bias. We need to look into cheaper places where we can get affordable human resource and skilled human resource. Women-friendly initiatives considering the large female workforce. Licensing easiness, labor law, customization, etc. Actually here one of the challenge which we really face is that we have a labor law which is applicable to everyone, and we are okay with that. But when we look into certain healthcare scenario, certain laws are impracticable. Suppose we have a hospital and we have a clinic, we got a tertiary care specialist, maybe a neurologist. In your one of the hospital, you don't have much patients to cater to him. He is a cost, but it is a specialty. But he cannot go and just spend 1 or 2 days in the other medical center because it is against the labor law. So that kind of practical issues are there. There should be some platform to discuss such issues and to find a solution that will definitely going to help the private sector. friendly yet aggressive quality policing by MOH, especially in terms of quality. We urge the MOH, actually recently, since 4 years, MOH has got a, private MOH has got a shape, especially after joining His Excellency Nabhani. They started actually implementing a lot of quality protocols and policies. Now they are doing periodic checks, inspections in the medical centers and hospitals. They are forcing the private healthcare industry to meet the international standard. That is a really healthy situation, which we welcome to that. We have 2-3 points, only 1 or 2 slides, Ahmed, I'm sorry, to debate. It's just thoughts or some suggestions. We are actually proposing a national board for quality management. If we wanted to bring an international standard private health sector in Oman, we believe that there should be a separate body for implementing the quality policies, protocols, monitoring that, and helping the private healthcare providers to keep it updated. A kind of separate body can be helpful. Common platform for growth, a steering committee. There is not a single meeting which is happening from the private sector people and the government sector. Okay, these are our issues. We need solutions for this. So we suggest the private Ministry of Health to form a committee which includes partners from the government as well as the private institutions, periodically meet and share the concerns each other and improve further. Grading for institution based on quality. This will be a healthy situation to promote the quality. Every year, let MOH evaluate the private hospitals and medical centers, grade them. Okay, you are a best quality hospital, very hygienic. You get A grade, you get B grade. This might positively affect keeping the quality. Preventive and positive healthcare, private public partnership. This is the last slide, Ahmed, sorry. When we go to India or some places, most of the planes are full with Omani nationals. They are flying to Bombay or Kerala to bigger hospitals for surgery. The cost actually is, most of the cost is bared by the government also. Diwan is sending people, MOH is sending people. The question is that, why do you want to send the people to India? Why can't you support the private health sector in Oman to create such facilities with some innovative solutions? I am telling that from a private healthcare provider perspective, if government is ready to support in terms like, okay, you go ahead with a tertiary care hospital, we will support you by providing this many cases or financial support, I am sure that there will be hundreds of investors, even from the Oman itself, say, yes, I will invest in the private hospitals because there is a financial viability. So we are asking, or we are ready to join with the public health sector, with the government, to develop such systems in this country itself if the government is ready to positively look into these concerns. If they are ready to join the hands with us, actually we can definitely develop a tertiary care system. We don't need to look into the external countries. We can do it because it's an emerging market. The people are very friendly. They're very energetic, intelligent, very curious to grow. We just need to see the support. That is why we have a dream, that is goodbye treatment abroad. Tomorrow I wanted to invite other people to Oman and get treated here. We need to say welcome to Sultanate.